Now that you know how to work the player, click on the Start button and let's get started.
Physical activity. Welcome to this video on physical activity during and after treatment. It discusses the benefits of physical activity, the American Cancer Society recommendations for physical activity, and tips for staying safe while you are exercising. Physical activity during and after cancer treatment. For the majority of cancer survivors, physical activity during cancer treatment is safe and can improve your overall quality of life. Research shows that physical activity can improve outcomes for survivors of breast, colorectal, prostate, and female reproductive cancers, endometrial, ovarian, and cervix combined. There is also growing evidence that exercise can help with other types of cancer as well. Physical activity can also help you to reduce fatigue, anxiety, depression, and lymphedema. It may also help you to improve your bone health, sleep, and quality of life. Recommendations for cancer survivors. The 2022 American Cancer Society Nutrition and Physical Activity Guideline for Cancer Survivors recommends that people with cancer receive physical activity assessment and counseling as soon as possible after diagnosis. The counseling can help you to assess your physical status and develop a personalized exercise plan that fits your needs. You may be able to find free or low-cost physical activity counseling or educational programs through your healthcare provider, local health department, community center, or the YMCA. In general, cancer survivors should try to avoid inactivity, return to normal daily activities as soon as possible, engage in regular physical activity according to their health status, and work toward the recommended weekly amounts of physical activity. The current recommendation for physical activity for general health has two parts: aerobic exercise and strength training exercise. For the aerobic exercise part, the recommendation is 150 to 300 minutes per week of moderate intensity activity, or 75 to 150 minutes per week of vigorous intensity exercise, or a combination of the two. Examples of moderate intensity activity are brisk walking, dancing, yoga, or bicycling at a leisurely pace. Examples of vigorous intensity activity are jogging or running, fast bicycling, jumping rope, or swimming. For the strength training exercise part, the recommendation is to engage in muscle strengthening activities 2 or more days per week. These can be done using resistance bands, free weights, weight machines, or your own body weight. Staying safe while exercising. It is important to consider your safety while you are starting or continuing an exercise program. Here are some general safety tips for exercising. Start out slowly with small amounts and build up to longer exercise sessions. Exercise according to your ability. Listen to your body and adjust accordingly. Avoid uneven surfaces that might cause you to fall. Find safe and well-lit spaces for activity outside, dress for the weather, and wear sunscreen. Bring someone else with you as necessary. Make sure someone knows where you are when you exercise. When you are creating an exercise plan, check with your medical team or an exercise professional if you are concerned about any issues from your cancer or treatment that might interfere with your ability to exercise. Although unlikely, exercising might be counterproductive or dangerous for some people. For example, those with weak immune systems should avoid public places such as gyms. Those with severe anemia should delay exercise altogether. Those who have skin irritation or sores from radiation therapy should avoid swimming pools until their skin heals. If you have questions or concerns about exercises that are safe for you, consider seeking guidance from your care team or from an exercise professional. Resources. This section describes several useful survivorship resources. The first resource shown on the left is an exercise is medicine infographic called Moving Through Cancer. It provides information about exercising during and after cancer treatment to help with symptoms and side effects. The second resource in the middle is from the American College of Sports Medicine and provides exercise guidelines for people with cancer and cancer survivors. The third resource on the right is an exercise is medicine directory of exercise programs in your state. Thank you for watching this video on physical activity during and after treatment. We hope that it gave you useful information and resources for your cancer journey. For more information on the benefits of healthy behaviors for cancer survivors, please see the other videos in the collection.